Welcome to our guide on understanding medical bills using the explanation of benefits, or EOB, and the summary of benefits and coverage, or SBC. Don't worry if it sounds complicated. By the end of this video, you'll be able to use these important documents with confidence. Let's get started. You probably know that medical bills and insurance can be confusing. Did you know that it has been reported that up to 80% of medical bills contain mistakes? That means you might be paying more than you should or for things that you shouldn't. Our goal is to help you understand the paperwork related to your medical care, so you spend less time being confused and have the tools and confidence to speak up for yourself. Before we dive into the details, let's talk about why it's important to understand your medical bills. It helps you know what services you received, what your insurance covers, and any extra costs you might have to pay. To get started, you'll want to gather up your medical bills, EOB, and summary of benefits and coverage. Let's begin with the explanation of benefits, or EOB. This is a statement you'll receive from your insurance company or find under your account on your insurance company's website. Even though it says it is not a bill, it is still important. The EOB tells you about the services you received, how much they cost, what your insurance covers, and if you owe any money. Here's how it works. Your insurance company looks at your plan and tells you and your healthcare provider how they are handling your claim. The EOB shows what your provider is billing for the care you received, how much the provider is allowed to charge based on the rate that the provider agreed to accept from the insurance company, the write-off, the difference between the amount charged and the amount allowed for your care, and how much you are required to pay. Of the amount that the provider is allowed to collect, the EOB shows how much you owe. You may be responsible for all or part of the allowable, or you may simply owe a copay or coinsurance for the services you received. The EOB will show how much of what you owe counts toward your deductible and out-of-pocket maximum. The EOB will also explain how much, if any, the insurance company is paying your provider. When you get your EOB, you'll want to make sure your name and the insurance plan are correct, especially at the beginning of the year if you have made changes in coverage. Sometimes the EOB will contain information related to more than one provider visit or service. Verify that the provider listed for each claim is the one you saw on the dates of service shown. EOBs might have what are called CPT codes. These codes tell the insurance company what services you received. If the EOB does not explain in lay language what the CPT code represents, you can do an internet search to find out. Now, compare the charges on your medical bill with the EOB. Check the dates, services, and costs. Did you receive all of the services listed? Were you told the cost would be one thing, but the bill or the EOB says something different? Are you being charged for something you shouldn't be, such as preventive care service? Examples of preventive care services include well woman exams, screening mammograms, or screening colonoscopies. Next, let's talk about the Summary of Benefits and Coverage, SBC. This document gives you a quick look at your insurance benefits, what types of services your plan covers, the rules that determine what you will pay for the care you receive, and other important details. You'll want to pay careful attention to the deductible, copay, and coinsurance costs, as well as what types of services are covered by the plan. By law, your insurance company must give you this information. Note that even if you are responsible for part or all of your premium costs, the SBC does not show these numbers. Also, the SBC is merely a snapshot of your benefits. For more comprehensive information, you'll want to review or at least have a copy of what is known as the Certificate of Insurance or Evidence of Coverage, aka EOC, which has far more details. If there is a discrepancy between the SBC and the EOC info is what counts. Let's look at this sample SBC. They're typically several pages long and provide an overview of the general types of services covered under your plan, how they are paid for, and by whom. Based on the insurance company's allowable amount, with the information found on your SBC, you can determine what your costs should be for a given service. Make sure it matches what your EOB and plan say. You should compare what you experienced during your medical visit with the bill and EOB. Make sure you were charged correctly and were not charged for a service or procedure you did not receive. If you're not sure, ask your insurance company, your provider, or both. Here is an EOB and a bill for a fictional patient, Robert Garcia. Robert went to his family doctor for a cough. Let's check to make sure everything is correct. First, let's look at Robert's bill from his doctor's office. Here we can see a list of charges, as well as payments made to the account by either the patient or the insurance company. According to the bill, on December 7th, Robert was charged for an office visit and a chest X-ray. In this case, Robert did receive each of these services. The bill shows that on January 3rd, Robert's insurance paid $101.51 towards the bill as shown here. Also on January 3rd, there was a write-off adjustment of $193.11. We'll discuss that more when we look at Robert's EOB in a second. According to the bill, with charges, adjustments, and payments provided by his insurance, that leaves Robert with a balance of $25.38 owed to his doctor. Now let's take a look at Robert's EOB to make sure that everything lines up. Remember that while EOBs from different payers being a term we use to refer to any commercial insurance company or government program, such as Medicare or Medicaid that pays for healthcare services, can look different, they will have most of the basic information listed here. This first column represents the date of service. The next column, POS, is the place of service and represents where Robert received services. 11 indicates the services were performed at the doctor's office. NOS indicates the quantity or number of the services performed. Next, we see the PROC column. Listed here are the CPT codes that indicate what services were performed. These may be codes, descriptions, or both. The billed amount is the amount charged by the provider for each service. The allowed column represents how much the insurance company has agreed to pay for a particular service. Note that the amount billed from the provider is almost always higher than what the insurance companies pay for those services. The difference between the billed amount and the allowed amount can be seen in this column here. Sometimes this is called the discounted amount. The difference is written off by the provider, and neither the insurance company nor the patient is responsible for this portion. In this example, in this column, we can also see reason codes that can explain why the claim is being paid the way it is. There's usually a glossary on the EOB that explains the codes. Most insurance plans require some form of a deductible or a set dollar amount that the individual or the individual and family are responsible for each year. This is on top of any monthly premiums paid to the insurance company. Coinsurance is a percentage of the allowed amount. Coinsurance can be confusing because the insurance company may have different coinsurance percentages for different types of services. We'll talk more about this shortly when we go through our examples. Copays are fixed dollar amounts and can apply both before and after meeting your deductible. You'll want to refer to your SBC to find out your copay, coinsurance, and deductible responsibilities. The final column represents the amount the insurance company paid to the provider. These numbers represent the allowed amount minus any deductibles, copays, and coinsurance for which the patient is responsible. Now let's look and make sure everything is correct for Robert. As we saw on his bill, the services provided, an exam, and an X-ray are the same as what we see on his EOB, so that's good. We can see that the total for the allowed amount is $126.89. Robert doesn't have a deductible because the charges were from December, and he had already met his deductible for the year. His coinsurance totals $25.38. This is subtracted from the total allowed amount for a total of $101.51 paid to Robert's provider by the insurance company. Looking back at Robert's bill, we see the billed charges total $320. From that, the doctor's office wrote off $193.11. This matches with the totals in the RC-AMT, aka discount, column on his EOB. Additionally, we can see a payment of $101.51 from insurance, leaving Robert with a balance of $25.38. This matches up with the co-insurance column on the EOB. So, all of this looks correct. There is just one more thing to check. We mentioned that co-insurance percentages may vary by service type, so we'll need to check the numbers on the EOB with what Robert's SBC says. According to his SBC, Robert is responsible for $25, or 10% of the allowed amount, whichever is less, for a primary care problem-oriented office visit after he has met his deductible. In this case, 10% of the allowed $89.39 would be $8.94, which is less than $25. For his chest X-ray, his coinsurance is 20% of the allowed amount, which works out to $7.50. However, in examining Robert's EOB, it appears that he was charged 20%, $17.88, coinsurance for his office visit, when it should have been 10%, or $8.94. This means that Robert's insurance should have paid $8.94 more to his provider, and that Robert owed $8.94 less. In this case, the difference in real dollars is relatively small. However, if it was a 10% error in coinsurance for a surgery charge or another type of expensive care, the difference between what the patient truly owed and what the EOB said the patient owed could have been a lot more. Robert will need to call his insurance company to have this corrected. Without looking at his bill, EOB, and SBC, Robert never would have caught the mistake and would have overpaid for his medical care. In the next example, we will explore a different situation. Here, our patient Tamika Smith went to her doctor for a cough and flu-like symptoms. In looking at her bill and EOB, we can see that Tamika was billed for an office visit, a COVID-19 test, and a chest X-ray. But wait, unlike Robert, Tamika never had an X-ray at her visit, so she knows that this is incorrect. Just to be sure, let's check the rest of her documents for any other mistakes. We can see that the patient and insurance responsibility amounts are the same on the bill and the EOB. The amounts applied to coinsurance have been calculated correctly according to the SBC. The write-off amount and provider-paid amounts are consistent with the billed and allowed amounts, as well as the coinsurance charges. The coinsurance percentages also match with the information in her SBC. The problem is that Tamika was charged for, and her insurance paid, and assigned her costs for the chest X-ray that she didn't have. So in this case, Tamika would need to call her doctor's office and insurance company to have the charge removed for the X-ray she didn't receive. If you find mistakes or have questions, call your insurance company. Their representatives can address problems you find on your bills and EOBs. If there is a billing error, you should also contact your provider. Before we finish, here are some quick tips. Keep your insurance documents organized and where you can easily get to them. Don't hesitate to ask for help from your insurance company's customer service department, and document any conversations with your insurance company or provider's office. Take notes, including the date of the call, who you talked to, the purpose of the call, what explanation you were given, if any. the plan to resolve the problem, and when to expect next steps. And that's it. Understanding how to compare your medical bills with the explanation of benefits and the summary of benefits and coverage might seem tricky, but it can be done. Take the time to look at your EOB, compare it to your bill, and make sure everything matches up with your plan and the medical care you received. Your health is important, and understanding your medical bills and insurance coverage gives you the power to take care of yourself, medically and financially.